Okay, it's session 5. You will get like 6.5 minutes. In 4.5 minutes, that means 4 minutes 30 seconds, I will give a warning that you have left only 2 minutes. Okay, so you can start.
Hi, my name is Dr. Bhomik and one of the doctor in this clinic. May I confirm your name and age, please?
Hello, doctor. I am Kate Parker.
And how old you are?
I am 62, doctor.
Nice to meet you.
Thank you, doctor.
Okay, so today we are here to discuss about your health problem. Is that okay?
Sure.
So would you please tell me what brings you here in clinic today?
Actually, doctor, I was okay 2 days back. Then I suddenly developed a double vision in my eyes. That's why I came to the GP, and GP sent me to you, doctor. Please help me.
Okay, I'm sorry to hear that. Uh, have you noticed the double vision in both eye or any specific eye?
Actually, doctor, I think it's in the both eyes. When I try to see in single eye, it vanishes. But when I try to see in my both eyes, then it increase, I think.
Okay. Have you had this episode previously or this is the first time?
Oh, it's the first time, doctor.
Do you have any date, any variation in the day regarding your symptom or
No,
any,
doctor. No, doctor. For the last 2 days, I have been suffering from this problem and continuously.
is there any factor that worsen the double vision?
Doctor, actually, when I tried to see in my lateral portion in the side of my eyes, then the intensity increases.
Okay. Have you noticed any deviation of your eyeball towards any side?
Mm, yeah, doctor. I think my eyes are not able to go in the right side and also in the left side, in the both side.
Have you had any headache?
For the last 2 days, yeah, I have been suffering from some headache. I think it's very low intensity. That's why I'm not addressing this symptom to you. But I have headache.
Have you noticed any redness or any swelling of your eyeball?
No, you can see there is no redness.
So, from your note, I've came to know that you are diabetic and also hypertensive.
Yeah,
So, would
you're
you
right.
please tell me for how long you are suffering from those problems?
Doctor, I am diabetic for the last 10 years, I think, and I am hypertensive for the last 8 years.
So, please tell me about your diabetic control.
I am taking metformin, and also I'm taking the the an antihypertensive drug. I can't remember the drug name, and I'm okay with my medications.
Can you please tell me about your 3 monthly diabetic control report called hemoglobin A1C?
I think last one was about 8.5 that my GP concerned about my diabetic control.
Do you have any pain in your chest?
No.
Any pain in your legs when you are walking or exerting?
No, doctor.
Okay. And apart from this double vision, have you had any problem with your eyes previously?
Eyes, no problem.
And have you noticed any unusual frothiness of your water work?
No.
Any burning or numbness in your limbs?
Mm, Burning, numbness, no, doctor. I think I have some weakness rather than in my left side of my body, but it's not very strong. I think very mild. I don't think so. It's a very important thing to tell you.
And for how long you have been suffering from this weakness?
This weakness maybe for the last 2 days or 2 days or 3 days. I can't remember.
And is it
There are
start
2
on
minutes
of a
left.
sudden?
2 minutes left.
Is it started on of a sudden?
Yeah. I think when I got from the sleep, then I noticed that.
Okay. Do you have any problem in maintaining of your balance for last 2 days?
No.
And any abnormal shaking of your hands?
No.
Any loss of sensation in any part of your body, in
No.
face or in the limbs?
No.
So I want to examine the cranial nerves, particularly the upper cranial nerves.
Yeah, you got bilateral 6 nerve pulse.
Okay, and also I want to examine the long tract sign, particularly the plantar response
Plantar response is equivocal.
and the reflex, and also
Reflex,
muscle power.
muscle power is normal.
And I also want to do a fundoscopy.
In fundoscopy, the signs are normal. Okay, you have.
So what is your concern?
Actually, doctor, I am concerned about the event. Is it curable or not?
Okay, so most likely this condition is due to damage of some nerves that control the movement
Okay, time is up.
of your.
Okay, thank you, doctor. So, doctor, how do you think about the differential? What is your differentials?
Sir, I'm not clear actually.
Okay, what might be the possibility? Any possibility, or do you think in your mind?
Bilateral six nerve palsy may be only due to diabetes.
Very good. So, diabetic
Only.
polycranial neuropathy, or okay, then
Vasculitis.
good, very good. এই তো সুন্দর অনেক ভালো ভাবে বলেছেন ওকে ঠিক আছে so what should be the treatment option for this patient?
First of all, I'll do some investigations like fasting blood sugar and 2 hours after breakfast, hemoglobin A1C. Then I'll do a MRI of brain and
Okay. MRI brain,
aquatic
only MRI of brain,
and all.
and also diffusion.
MRV and MRA.
I think with diffusion, because we have to see the ischemia, okay, or ischemic change. So in early stage, or if it is very subtle any ischemic change, then in normal MRI may not detect it in early phase. So we can do the diffusion, the capacity. I think.
Weighted image.
Yes. Okay. Any other differentials, like it may be a transient ischemic attack, right? And also, as it is very sudden in onset, so it may be any microvascular
So
complications.
persisted for 2 days. Could it be still TIA?
No. I thought that initially we can. I'm not asking any questions right now as an examiner. I'm just discussing with you. As an initial stage, we can think about TIA or stroke, because this is happened very suddenly, I think.
Sudden.
Yeah. So sudden onset, it may be you have told me that it could be a diabetic polyneuropathy or diabetic cranial neuropathy. That's the most important differential, I think. And also some other vascular problem, like if there is any microvascular or thromboembolic any complications due to this patient, as this patient have diabetes and also hypertension. So this patient has very prone to this kind of disease, I think. And also this patient has bilateral 6 nerve palsy. So okay, let's go to the point that I think we should discuss about this case, about the history and the examination, if you permit me. Okay, so first of all, you have asked the patient about the onset of the symptom. That is the open questions. Very good. And but you didn't ask about that. Is it vertical or horizontal? The double vision. And about the any drooping of the eyelids, because in case of complex ophthalmoplegia, because complex ophthalmoplegia and also a cause of the sixth nerve palsy or the double vision actually. So we have to ask about the any drooping of the eyelids, because in cranial nerves 3 or any neuromuscular disorder like the myasthenia gravis can also cause the diplopia in the patient. And in case of headache, I told you that I have headache. So I think you have to ask me some more questions about the headache. When it onset, is it at the same time with my the initial symptom? Because it may be due to raised ICP, isn't it? Because raised ICP may cause cranial neuropathy, especially cranial nerve 6 and also cranial nerve 3, because it has a long course, you know. Then you asked me about the visual symptoms, very good. And you didn't ask me about any hearing problem or any fatigable weakness, because myasthenia gravis may cause diplopia, as myasthenia gravis is a neuromuscular junctional disorder. So it may cause ophthalmoplegia, and it may cause the double vision. You didn't ask me any bulbar symptoms, like any dysphagia or dysphagia or dysarthria, any nasal regurgitation, because you know that in case of complex ophthalmoplegia due to brainstem involvement, so this patient may have diplopia as well as the other the bulbar symptoms, I think. And you asked me about the stroke symptoms, very good, because stroke, this patient has also some numbness and weakness in the left side of the body. So stroke is a good possibility in this patient, and because of the microvascular complications. And you didn't ask me about my social history, like the smoking and alcoholism, because you know that this patient has diabetic and also hypertensive. So smoking history is very important. And another is that social care. Social care, whom do I live with, and if anyone is helped in my home, because in my disability, if I have. Okay, in case of drug history, you asked me about my drug history. That is very important. And hemoglobin A1C, you asked me, very important, very good. In case of examination, so cranial nerve examination. Did you examine my cranial nerves? Yes, you got sixth nerve palsy, very important. And you didn't see my pupil, because you have to examine my pupil as well as is there any internuclear ophthalmoplegia and RAPD, right? Because this patient has sixth nerve palsy and also the diplopia. So internuclear ophthalmoplegia is a good differential as a cause behind like the multiple sclerosis. Multiple sclerosis is an inflammatory disorder that may present with acute or subacute stage, isn't it? So examination of the pupil as the internuclear ophthalmoplegia and RAPD, I think, is a good important examination. Fundoscopy you have done, very good. And temporal artery tenderness, I think it may be done. I don't know about it, whether it is important or not in this case. So these are the actually my observation about you. If anyone add with me, you can, or criticize my observation, you can tell me right now.
So multiple sclerosis may be a differential in this case.
In differential, so as this patient have cranial nerves involvement, you know, multiple sclerosis may cause some cranial neuropathy, because some cranial nerves have, though the cranial nerves are lower motor neuron, but some cranial nerves has oligodendrocyte as the myelination in some part of the root. So it may cause like the trigeminal neuralgia, you know, as a trigeminal neuralgia is a one presentation of multiple sclerosis. And also inflammatory disorder may also cause this kind of diplopia. So just examine this patient pupil, whether this patient has any internuclear ophthalmoplegia or RAPT. Just I'm telling like that. Okay, so in this case, I think the differential, most important differential should be the diabetic cranial neuropathy and also the stroke. Though this patient have presentation of a bilateral presentation, sometimes pontine, pons is a very small area, so pontine stroke may cause, sometimes bilateral stroke may happen. Okay, so what is your opinion?
That's right, right. Yeah.
Okay. One important thing is written in the book. Should I tell?
Yes.
Okay. So neurological causes for binocular diplopia are due to problem with the extraocular muscles, that is myopathy, or their innervation like the cranial nerves and the nuclei in the brainstem, or interaction between the nerve and muscle like the neuromuscular junctional disorder like the myasthenia gravis. So in neurological cause due to diplopia, so we have to think about the myopathy, we have to think about the innervation of the cranial nerves and the nuclei like any stroke or any inflammatory disorder, and also we have to think about the neuromuscular junctional disorder like the myasthenia gravis. Another important point is here, sixth nerve palsy from pontine stroke would leave quadriparesis and bilateral small pupil. So in case of sixth nerve palsy due to pontine stroke, so this patient would have the quadriparesis and bilateral small pupil. A unilateral sixth nerve palsy, a unilateral sixth nerve nucleus lesion will cause ipsilateral lateral gaze palsies, that is the failure of ipsilateral eye abduction and contralateral eye adduction due to lesion in the ipsilateral paramedian pontine reticular formation. That is very, I think, অনেক কঠিন কথাবার্তা পড়া দরকার নেই. Okay, should we go in the next session? Or anyone want to tell anything or ask anything or add anything? You can tell. Yeah, I think there is no anyone. Okay, so দাদা তাহলে আমরা তাহলে সেকেন্ড কেস শুরু করি, কি বলেন? আপনার কেসটা আমি শুরু করি। কেস দিবেন আমাকে? চ্যাট বক্সে দিয়ে দেন তাহলে।
হোয়াটসঅ্যাপে তাই, হ্যাঁ?
দাদা চ্যাট বক্সে দেন, তাহলে এটা ওই ই করতে পারবো, এখানে দিতে পারবো। দাদা দিয়েছেন?
না। চ্যাট বক্সে দিতে হ্যাঁ। হ্যালো, হ্যালো।
হ্যাঁ দাদা শুনতে পাচ্ছি, আপনার মনে হয় একটু ইকো আসতেছে।
আচ্ছা, আমি
আপনি মনে হয় দুইটা আইডি, একটা আইডি একটু মিউট করে দেন। হ্যাঁ,
একটা আমার মিউট করা আছে।
ইকো আসছে। আচ্ছা ওকে, আপনি চ্যাট বক্সে দেন।
আচ্ছা, আমি চ্যাট বক্সে দিতে পারছি না, হোয়াটসঅ্যাপ গ্রুপে দেখো।
আচ্ছা আপনি দেন আমাকে, আমি
হুম।
দেখছেন। আই থিঙ্ক দেখতে পাচ্ছেন না? ক্যান ইউ হিয়ার দিস, ক্যান ইউ সে দিস রাইট নাও? আমাকে একটু সময় দেন, আমি একটু দেখি। Okay,
Are
should
you
we
ready?
start?
Okay,
Okay, done.
start. Time given.
Hello, good evening.
Hi, doctor. Good evening.
My name is Dr. Khan. I am one of the doctors here. Am I talking to Mr. Brain Jones?
Yes, doctor.
Okay, can you confirm your age for me?
It's 56.
Okay, how can I address you? How should I address you?
You can call me Jones.
Okay. So, Mr. Jones, I have heard that you have been suffering from some problem with your yellowish discoloration of the skin and sclera. Can you tell me a little bit more about it?
Yeah, doctor. I was completely all right 4 days back. When I have noticed some yellowish discoloration of my water and my eyes and also my skin. It
Mm,
with some pain in my upper tummy. That's why I come screening today.
I'm very sorry to hear that. Uh, so, I want to ask you a little bit more about it. Is that okay?
Yeah, yeah, proceed,
Okay,
please.
let's come to the first symptom of your like the jaundice or the yellowish discoloration of your skin. Is it very sudden onset or is it gradually increasing?
I think it increasing gradually for last 4 days.
So what
Begins seriously and that it increases gradually.
what areas you actually noticed about the yellowishness of your body?
Yeah, in my eyes and also in my skin and in my water.
Okay. Um, is that affecting your day-to-day life?
Yes, because of some, I feel very nauseated and can't eat properly, and I vomit one times. I have some pain in my tummy, so I can't attend my job. That's really bothered me.
And you told me about your tummy pain. Can you tell me a little bit more about it? How it actually happened to you?
Actually, it's not so severe. It's dull. I think it's constant, present all over the time, and I feel it change with my breathing. When I take a deep breath, the pain increase, and it's in my right tummy.
So, is it in the right side of your tummy?
Yes,
Is it in the upper part or lower part of your right
yeah,
side?
it's in the right upper tummy, just below my chest. I think.
So, is it happened in concomitantly with your the yellowish discoloration of your skin?
Yeah, yes,
Yeah.
4 days back.
Is it increasing this pain intensity?
No, I don't think so. It remained constant since the beginning, and it's not so severe.
What do you think about the severity if we scale it in 1 to 10, where 10 is very high and 1 is very low pain?
Maybe 3 or 4.
Does it remain on your right side of the tummy or it reduces to any other part?
No, it's remain at the same place.
Is there anything that helped you to relieve the pain?
Actually, I tried cocodamol, which the doctor prescribed me for the hip pain, but I think that doesn't help.
Okay, so cocodamol slightly helped you from the pain, but it's not helping your tummy pain, isn't it?
Yeah.
Okay, is there anything that increasing of your tummy pain, any work or anything like that?
No, apart from breathing, I can't understand that anything increase the pain.
You told me about the vomiting. Can you remember how many times you vomit?
It's just one times,
One time.
and the vomiters contain what I taken previously. Not associated with any blood.
Is there any blood in the vomit?
No.
Okay, any? Can you tell me the color of the vomit? Is there any unusual, like the coffee color, like this?
No.
Okay. So you told me about a hip pain that your doctor prescribed you a cocodamol. Can you tell me a little bit more about the hip pain, how it originated or how it happened, and how it was managed?
Oh, approximately 16 years back, I had a bad traffic accident, and my femur was broken at the time, and it was fixed by some operation. And since then, I have some bad pain in my hip, and for
Okay,
that
sorry.
reason, doctor prescribed me cocodamol, which I need to take frequently.
So the cocodamol, is it helping your hip pain?
Yes, definitely.
Okay, so after taking the cocodamol, when you are taking the cocodamol, what do you think about your tummy pain and the urinary discoloration? Is it increasing after taking the cocodamol? What do you think?
No, actually, I have taken this drug for a long period of time, and I haven't noticed any recent change in
Okay, okay,
tummy pain after taking crocodile.
okay. Do you have any loose motion or diarrhea?
No,
Okay. Did you took any other medication apart from the cocodamol?
no, not at all.
Okay.
I'm otherwise healthy.
Okay, apart from your the road accident, is there any medical or surgical condition that should I aware of?
No,
Okay. Did you take any
okay.
blood transfusion previously?
But I'm not sure whether any transfusion was given during my accident. Maybe, but I'm not sure.
Okay. I want to ask about your family. Whom do you live with?
I live with my wife and my two child.
Okay. Do you have any health illness that runs in your family that may be from your father's side or your the spouse side,
What type of illness, doctor?
like the jaundice, the long term of jaundice or any liver problem,
No, my father has hypertension. Otherwise, all of the family members are healthy.
and your wife, is she okay?
Yeah, okay. Thank you, doctor, for asking that.
Did you got vaccination previously for any virus?
Yeah, I have got coronavirus vaccine.
Yeah. Any other vaccine like any hepatitis vaccine?
I can't remember the vaccine that may given when am, I'm an infant, but after reaching my adulthood, I can't remember any vaccination was given.
Do you have any allergy to any kind of medication or any food?
No, not at all.
Okay. Now I want to ask you some personal questions. Is that okay?
Yes,
Okay. Do you smoke?
yes, maybe 5 to 6 sticks a day for last 10 years.
Okay. Have you ever think of quitting of smoking?
No, because
Okay.
I think it's too little.
Okay, we will talk about it later. Are you do you drink alcohol?
Yes, doctor. Yes.
So how many amounts you take?
I'm sorry to say that I drink a bit more. Maybe 1.5 bottle wine a day.
Okay. So why do you take this alcohol and do you have any depression or for any reason
Yes,
that you are
I have
taking
some
this?
stress in my work, and I think I'm habituated with this drinking. I have some tremor, shaking of my hands. if I not drink.
Have you
Not
ever
work
thinking of
properly.
quitting of the drinking or like this? Have you ever seeked any help in the hospital?
No, not at all.
Okay, all right. We will talk about it later. And I want to ask you a little bit more private questions. Actually, don't take it personally. We questions all the patients here. Is that okay?
Yes, please.
Okay. Are you in a stable relationship?
Yeah, I live with my wife.
Okay. Any extra marital affair like that?
No, no, no.
That's fine. Okay. I want to ask you further few questions so that I can't miss anything. Is that okay?
Yes, please.
Okay. Do you have any fever?
No,
Okay. What about your weight? Is that changed in recent time or stable?
maybe I lost 1 kg weight over this period of 4 days because I
Okay.
can't eat and drink properly. I think.
Okay. Do you have any breathing problem?
No,
Any racing of the heart?
no,
Okay. Any joint pain apart from your recent the accident?
no,
Okay. Any skin rash?
no,
That's fine. Any apart from any tummy pain, do you have any swelling in your tummy or any part of your body, any swelling? Any lumping, bumping in your neck areas?
no.
That's fine. So, how do you think about your illness? Why this is happening to you? What do you think?
Doctor, I'm afraid because one of my friend died of cirrhosis few days ago. Do I develop cirrhosis of my liver? You have
Okay,
2 minutes remaining.
okay. Actually, your all the symptoms are not like the cirrhosis of the liver. So I don't think so. You have been suffering from cirrhosis of the liver. Rather, I am thinking about any acute infection or any inflammation that may occur in your liver that is causing your all symptoms. It could be a viral infection like the hepatitis virus, and also it could be due to your medication that you are taking, the cocotonol. Sometimes it may cause some inflammation of the liver that may present with this kind of the yellowish discoloration of skin and tummy pain, all the symptoms. So I don't think so you have any cirrhosis uh, of the liver. So to confirm your the condition, we have to do some further test that will involve some basic tests like the full blood count, your blood sugar level, your liver function test, your renal, the kidney function test, and also we'll arrange some scan of your tummy so that we can see more clearly what is happening in your the liver and in any other organ of your tummy. And we will review the drug you are taking right now for the pain of your accident. So is it affecting in your liver or not? Are you getting my points?
Yes.
Do you have any further queries?
May I have a cancer in my liver?
Why do you think that you have cancer?
Because I think jaundice is a sign of liver cancer.
Okay, jaundice may be a sign of liver cancer, but having jaundice is not does not necessarily mean that you have cancer. Rather, your presentation is very few days, so I don't think so you have any cancer. And to rule out this possibility, we also arrange some tests so that we will be more sure, and you will be more sure that you don't have the cancer.
Time up. Thank
Okay,
you, doctor.
thank you.
So, what are your differentials for this case?
I think the differential could be a viral hepatitis, acute viral hepatitis, and
Yeah.
also drug-induced hepatitis due to the opioid, the cocotamol.
Any other differentials?
At this point, I don't have any other differentials.
How will you investigate this patient?
For the investigation, some basic blood tests like the complete blood count to see whether this patient has anemia or raised ESR. And I will do the blood sugar level, and I will do liver function test, especially the HGPT and HGOT, that means ALT and AST level. In case of hepatitis or hepatocellular injury, the ALT level will be very high, and whether if the patient has the alcoholic hepatitis, that should be another differential in this case. So in that case, the AST level will be very high as this patient has a heavy drinker. And also we will arrange some other tests like the ultrasound of the abdomen, and after and also viral markers like the hepatitis A, hepatitis A, B, and hepatitis E. So these are the initial investigation. After getting this test result, then we will go further testing if the patient is needed or not.
Okay, so your first differential is acute viral hepatitis.
My first differential should be the acute viral hepatitis. Second is drug-induced
Okay.
hepatitis, and third is
Does the
alcoholic
patient have
hepatitis.
any risk factor for viral hepatitis?
This patient had surgery in 16 days ago. So during
16
surgery,
years.
sorry,
16 years.
16 days ago. 16, you told me about 16,
Yes.
16 years. Okay, I didn't get about that.
Okay,
So,
that's okay.
okay, so as this patient has don't know about 16 years, okay, it may be come due to any fecal route, like in case of hepatitis A or E. Suppose having a food containing hepatitis A or hepatitis E virus, so it may
So is
cause
it common
hepatitis.
in UK?
No, it's not common in the UK, but I don't know about the
So have you
patient's
took
risk.
any travel history?
Oh no, that is the mistake, I think. So we should do a travel mistake. Sorry, travel history at this patient.
Any injection of any shellfish recently?
Yeah, I missed it.
So Dr. Savar, first of all, I think you have mentioned discoloration of the sclera.
Okay, it's jargon. I think it's a
So
jargon.
yeah, it's
I think
jargon.
we should
Avoid
avoid
it.
this.
Discoloration of eye is better.
Yeah.
Okay. You don't ask any previous episode of jaundice. So is it the first time, or have you had this type of episode previously? Okay.
Yes, yes, you're
And
right.
a very important history with jaundice is the presence of itching. What's the color of your stool?
Yeah,
Okay, the
right.
stool is very important to exclude the obstructive
Mhm.
pattern of jaundice. Okay.
I missed it, yeah.
And as I'm saying that I'm a heavy drinker, so you should ask the case questionnaire for the uh, chronic alcohol
Alcoholic
use.
hepatitis, my third differential.
So you should ask the case questionnaire. Case,
Like,
that means, do you want to cut off your drinking? Are you feel annoying or annoyed by the others' comment regarding your drinking? Have you feel guilty because of your excess drinking? Or do you think your first task is drinking after waking in the morning to prevent the hangover or to prevent the shaking? So I should ask this. And
right.
as this patient is a heavy alcohol user, so is there any social or mental issues regarding this alcoholic abuse? Any issues regarding drinking because of this alcohol abuse? Okay.
দাদা এটা একটু আমাকে দিয়েন, হ্যাঁ, যেগুলো বললেন একটু পয়েন্ট করে আমাকে
যে
লিখে দিন।
বইটা আছে দেখে নিন।
একটু পয়েন্ট করে দিয়েন।
ঠিক আছে। Then drug history. Do you increase your dose of cocodamol recently?
Right.
Maybe a case of paracetamol overdose if the patient increase the dose of cocodamol by himself. That's important. Okay.
Right.
And whether the patient has any background chronic liver disease. You have asked for hematemesis and melena, and also asked for abdominal distension. But you may ask for any recent change in sleep pattern, any alteration of consciousness, as
So
this patient may have.
so we should ask about any CLD feature, like, right?
Yes.
Okay.
Maybe patient develop acute flare of chronic liver disease.
Right.
And also complications of acute hepatitis like encephalopathy. So you should ask the patient, have you had any recent change of your sleep pattern, any confusion, like that. Okay.
Okay.
And although this is a male patient, so autoimmune hepatitis PBC may also be in your differential, but not, I think, after in final differential. You should exclude this by asking some question. Do you have any known thyroid condition, or do you have high blood sugar or diabetes? Like searching for other autoimmune condition associated with autoimmune hepatitis and primary biliary cholangitis. Okay. And regarding the differential, first should be alcoholic hepatitis. Then you may told the other differential you have mentioned, that maybe viral hepatitis. And they also mentioned that it may be due to gallstone disease and liver metastasis. Those conditions are associated with jaundice and also abdominal pain. Is that okay?
Yeah, sure. That's very nice.
Do you have any question?
No, I have no any question, but if the audience have any question, they can ask.
Yeah.
Dr. Sandeep Kumar is a full-term gastroenterologist. You can get a lot of gastro case from him and lot of answers as well. So you can ask him about the gastroenterology. So I think our audience have no any questions. Okay, so I think we should end the session. Okay.
Okay, thank you, Dr. Sir. Thank you.
Thank you. ভালো থাকেন। প্রত্যেকদিন একটা করে কেস করতে পারলে খুব ভালো হয় আর কি।